Hello and welcome. Today we're diving into the world of kidney health to explore a condition called acute tubular necrosis, or ATN. ATN is a serious kidney disorder characterized by damage to the tubule cells of the kidneys, which are crucial for filtering waste and maintaining fluid balance. Join us as we unravel the causes, symptoms, diagnosis, treatment, and more about this critical condition. So, what exactly causes ATN? The causes of ATN are generally categorized into three main groups. First is ischemia, or reduced blood flow to the kidneys. This can occur due to shock, severe dehydration, surgery, or major trauma. Second, nephrotoxic agents. These are substances that are toxic to the kidneys, such as certain medications like aminoglycoside antibiotics, NSAIDs, chemotherapy drugs, contrast dyes used in imaging procedures, and heavy metals. Finally, sepsis. This severe infection can lead to kidney damage and ATN. Now, let's understand what happens in the body during ATN. The pathophysiology of ATN is a complex process. When kidney tubules are damaged, their ability to filter waste and regulate fluids and electrolytes is compromised. This leads to a build-up of waste products like creatinine and urea in the blood, resulting in what we call acute kidney injury. Damaged cells slough off and can obstruct the tubules, further hindering kidney function. Inflammation contributes to the injury, and the kidney's ability to concentrate urine is also impaired. This cascade of events disrupts the delicate balance necessary for kidney health. Let's consider the prevalence of ATN in the population. ATN accounts for a significant proportion of cases of acute kidney injury, or AKI, particularly in hospitalized patients. It is estimated that ATN causes about 50% of AKI cases within the hospital setting. Individuals who are elderly, have pre-existing kidney disease, diabetes, heart failure, or are critically ill are at higher risk of developing ATN. What are the telltale signs and symptoms of ATN? The symptoms of ATN can vary in severity, but often include decreased urine output, also known as oliguria. Fluid retention can lead to swelling in the legs, ankles, or feet. Fatigue, shortness of breath, nausea, confusion, and irregular heartbeat can also occur. In some cases, ATN can be asymptomatic, meaning there are no noticeable symptoms, especially in the early stages, making diagnosis challenging. How is ATN diagnosed? Diagnosing ATN typically involves a combination of physical examination, medical history review, and diagnostic tests. Blood tests are crucial to assess kidney function, measuring levels of creatinine and blood urine nitrogen, or BNN. A urine analysis can reveal abnormalities such as the presence of protein or cellular debris. Imaging studies, such as ultrasound or CT scans, can help rule out other causes of kidney dysfunction. A kidney biopsy, while not always necessary, may be performed to confirm the diagnosis and assess the extent of tubular damage. While not formally classified into types like some diseases, ATN can be broadly categorized based on its underlying cause. Therefore, we often talk about ischemic ATN, resulting from reduced blood flow, and nephrotoxic ATN, due to exposure to harmful substances. Understanding the underlying cause is crucial for guiding treatment strategies. So how is ATN treated and managed? Treatment for ATN focuses on addressing the underlying cause and supporting kidney function until the tubules can repair themselves. This may involve discontinuing nephrotoxic medications, optimizing blood pressure and fluid balance, and managing any underlying infections. Dialysis may be necessary to remove waste products and excess fluid from the body if the kidneys are unable to do so adequately. Nutritional support is also important to ensure adequate calorie and protein intake. Careful monitoring of electrolytes and fluid balance is essential throughout the treatment process. Can ATN be prevented? While not all cases of ATN are preventable, there are steps you can take to reduce your risk. Staying well hydrated is crucial, especially in situations where you may be at risk of dehydration. Avoiding unnecessary exposure to nephrotoxic medications and contrast dyes is also important. If you have underlying medical conditions like diabetes or high blood pressure, managing them effectively can help protect your kidneys. Regular check-ups with your doctor can help identify and address any potential risk factors for kidney disease. What is the prognosis for individuals with ATN, and what advances are being made in research? The prognosis for ATN varies depending on the severity of the condition, the underlying cause, and the individual's overall health. With prompt diagnosis and appropriate treatment, many people with ATN can recover kidney function. However, in some cases, ATN can lead to chronic kidney disease or even kidney failure, requiring long-term dialysis or kidney transplantation. Research is ongoing to better understand the mechanisms of tubular injury and to develop new therapies to promote kidney regeneration and prevent progression to chronic kidney disease. Recent research has explored the potential of stem cell therapy and other regenerative medicine approaches to repair damaged kidney tubules. Thank you for joining us on this exploration of acute tubular necrosis. We hope you found this information helpful in understanding this important kidney condition.